So I'm a consultant pediatrician. I have a special interest in epilepsy and neurodevelopmental disorders. I also run clinics for migraine in children. So epilepsy in children occurs at an approximate frequency of 1 in 100 children. So it's not an uncommon entity, and it could present at any age, and therefore it is something that we do see fairly frequently in my clinic. Children could present with different types of episodes, which are called seizures. And most commonly, we see those generalized one where the child may fall down, become unconscious, starts jerking all four limbs. But then there are some more other subtle forms of epilepsy in which some children just look absent and vacant, and it could be confusing for the onlooker to wonder what this could be. So it's just to bear in mind that this may need a medical attention, this may need some expert opinion and investigations. So we do investigate epilepsy by doing an electroencephalogram, commonly known as EEG, and then hopefully come to a clear-cut diagnosis that will help us decide on the exact medication that will help. Once in a while, we do brain imaging to find out whether there's an underlying secondary factor in the cause for the epilepsy. And then we take a decision about medication. Often it is for a longer period. There are some epilepsies which are self-resolving, but unfortunately there are other epilepsies which are lifelong. So many children are on lifelong treatment for the same. So if you notice your child to have an unexpected episode without any provocation, and if that child shows seizures, which you can obviously see and identify, then you need to contact a medical professional. Ideally, children who are suspected to have seizures, including those very subtle ones in which there might be vacant episodes or sometimes just very confusional episodes, and some sudden acute changes in behavior could also be a form of epilepsy. So it is best to contact a medical professional, ideally within a 2-week period, to get an assessment done. Yes, sometimes children who, particularly in the autistic spectrum, they are for some unclear reasons more prone to have epileptic seizures, and even other neurodevelopmental disorders like ADHD or learning difficulties or learning disability, they are sometimes more commonly associated with epileptic seizures. So one has to bear that in mind. One may even need to assess neurodiversity characteristics separately. And in the Midland Health, there is a service for the same. Here we have professionals, and I personally assess children for autism. We do what's called a multi-disciplinary assessment, where we have a speech and language therapist who does some specific kind of testing, which helps in the diagnosis of autism. We also get information back from any source, such as the school, who may have seen the child for good periods of time and could share useful information. In all of this, we find that getting the parent involved in the whole process is very helpful. And it's part and parcel of the way we make a diagnosis for these conditions, is that to keep the family engaged and involved, and they actually contribute to the assessment. So broadly speaking, epileptic seizures occur without a precipitating factor or a trigger. But there are some known situations which could reduce the threshold for epileptic seizures. So one of them is lack of sleep. So we always encourage them to have proper sleep. Sometimes emotional stress could also lead to a situation where the threshold for seizures gets reduced and one may get an epileptic seizure. One other important aspect is photosensitivity. So some people with epilepsy are very sensitive to certain types and certain frequencies of light. So particularly if there are flashing lights, such as in flash photography, or strobe lights like in a discotheque, then those children who are known to be photosensitive, we often are able to test whether a child has photosensitivity or not. And then we recommend avoiding those situations or other strategies which could reduce the effect of those sudden flashing lights. I do clinics in epilepsy, autism, and migraine, and other neurodiverse conditions. and I'm contactable by the reception here. You can also search for my details and book a clinic online.